So today, instead of the bony skeleton that we were so used to looking at, we have an identifiable human model in front of us and staring kind of blanklessly at our eyes, waiting to teach us something. And we are going into the details as to what this model is trying to teach us or will be teaching us as we explore the title of the neck. Okay, the human neck, that is the topic of discussion that we have today. But obviously, the neck is a pretty deep, interesting, obviously, but a deep domain of study. And so it's difficult to cover all of that in one lecture. So obviously we won't be doing that. What we will be doing though is, break it up into segments as a textbook has, break it up into segments and then cover those segments sequentially. So we are starting with the neck, okay? And, head, neck, this together, they actually constitute a domain of the anatomical textbook, the typical anatomical textbooks that we see. So head, neck is one domain, brain, that is the neuroanatomy, is another domain, thorax is one domain, abdomen is one domain, supex, that is the upper limb, is one domain, and infex, the lower limb, is another domain. So these are the domains, and today from the head neck region we're studying the neck. We're starting the neck, and the first thing that we are going to try to cover in this neck portion is the superficial things about the neck. Okay, so obviously there is a methodical way of targeting this region. The intelligent way of dealing with this would obviously be to go from the superficial structures to the deep structures. Okay, when we study any anatomical model or any anatomical region, we obviously start like that. We go from the superficial parts to the deep parts. Obviously, I think there should be an exception to this rule when we study the perineum. But obviously, that is very distant to this topic and not at all related to this. So, in the case of the neck, we are going to study the superficial regions of the neck, the superficial layers or parts of the neck today. And in that, we obviously start with the skin of the neck. Okay, the skin of the neck. Okay, obviously, when we remove the skin from the cadaver, we are encountering the superficial fascia or fascia, then the deep fascia or fascia, and then obviously the different muscles and other related deep structures, the deep arteries, nerves, and stuff. So talking about the superficial skin of the neck, the first thing that I would like to point out is the presence of certain lines on the skin. Now listen to me very carefully, okay? See, what I'm trying to point out here is, throughout the human body, there is a distribution of a set of lines which are known as the Langer's lines or wrinkle lines, or they're also known as the tension lines over the skin. Let me explain to you what they are. They actually represent the distribution of the collagen fibers in the dermis of the skin. Okay, so the direction of the distribution of the collagen fibers of the dermis of the skin is represented by these lines known as Langer's lines or wrinkle lines or tension lines. Okay, so in case of the neck, these Langer's lines, they are somewhat transverse. Okay, they are somewhat transversely oriented. Now, what is the need for knowing the direction of the Langer's lines, you might ask? Obviously, our need to know something must be fueled by an impetus. Why should we know that? So the reason for knowing the direction of the Langer's lines is a surgical advantage. Okay, so we get a sudden surgical edge if we know the direction of the Langer's lines, and surgeons often exploit this knowledge. How? Let me tell you. Since the Langer's lines in the neck, they are actually oriented transversely, so surgical incisions on the neck are also somewhat transversely operated by the surgeons. Okay, so that is a very important reason why we should have somewhat idea about the direction of the Langer's lines. And obviously, what are the Langer's lines? Let me repeat it. They are the lines representing the direction of the collagen fibers in the dermis of the skin. Okay, so they represent the lines of tension or wrinkle lines, right? Right. So that is the first point that I wanted to make about the skin of the neck. See, let me explain to you if you're not getting my approach here. What I'm trying to do here is not random. I did not randomly say about the Langer's lines here. We are going sequentially. We are studying the neck and we are trying to do it in a sequential order, right? So if we are to study a domain of anatomy sequentially, we have to go from the superficial to the deep structures. In case of the neck, the most superficial structure is the skin, okay? And that can be well said for any anatomical domain of the body, right? So we are trying to see if the skin of the neck has some special features which makes it unique, and we are trying to study those features. In that, the first point that I made is that of the Langer's lines, which are not only limited to the neck. Okay, so you should not have any confusion about this. It's not like only the neck has these Langer's lines or tension lines. They are spread throughout the body. In the neck, the Langer's lines are transversely oriented, and hence, in case of neck surgeries, surgeons often, cut or rather operate surgically on the neck in transverse incisions along the orientation of the collagen fibers of the dermis in the skin. Okay, right. Now, what other points can we make about the skin of the neck? Obviously, we can talk about the cutaneous nerve supply of the neck, right? If you're talking about the skin of the neck, the superficial structures related to the neck, then obviously it won't go beyond our scope to study about the cutaneous innervation of the neck, right? So mark my words when I say that the cutaneous innervation of the neck is supplied by the spinal segments of C2, C3, and C4. Okay, so these three cervical segments, we haven't studied spinal cord yet. I do know this, but I think that a general idea of what cranial nerves are, what spinal nerves are, what the spinal segments are, this is somewhat a general concept, right? So obviously when we will be dealing with spinal cord in details, we would know about this in a lot more detail, right? But I think we are at par when I say that the cutaneous innervation of the neck region is by the spinal segments C2, C3, and C4. Okay, so now a question may arise as to why C1 is not included in this. The reason is very unique. Unique in the sense that C1, this spinal segment, has no cutaneous innervation. That is so unique. See, almost all the spinal segments, right? The cervical segments, the thoracic ones, lumbar ones, and so on. They, give off different spinal nerves, and ultimately they are somewhat related to the cutaneous supply throughout the whole body. But C1 serves as an exception to that, in the sense that it does not actually have a sensory cutaneous innervation. So the neck is actually supplied by the C2, C3, and C4. Okay. Okay. And what about C5 or T1, T2? What about them? So you see, C5, C6, C7, C8, and T1, they actually form the brachial plexus. So that is pretty interesting. You see, before C5, prior to C5, from C2 to C4, we have the cutaneous innervation of the neck. But from C5 to T1, we have the brachial plexus. Obviously, the ventral rami of C5 to T1 forms the brachial plexus. If the formal knowledge of upper limb is there, we can say this, right? Right. So the ventral rami of C5 to T1 forms the brachial plexus. We know this. And C2 to C4 is supplying the neck. However, there is a catch to this. What is the catch? See, when I say that C2 to C4, these segments are actually supplying the skin of the neck, I'm overgeneralizing the fact as to what parts of the neck they are supplying. What I mean by this statement is that the anterolateral regions of the neck, that is the front of the neck, roughly speaking, the front of the neck, they are supplied by the ventral rami of C2, C3, and C4, whereas the posterior parts of the neck, they are supplied by the dorsal rami of C2, C3, and C4. Okay, so, and that is pretty self-explanatory, because this is the dorsal part of the body as well, and this is the ventral part of the body. So dorsal part of the neck, the dorsal part of the cutaneous innervation of the neck, is actually being performed by the dorsal segments of C2, C3, C4, whereas the ventral part is being supplied by the ventral rami of C2, C3, C4, right? So pretty self-explanatory, right? Now there is another piece of information that I would like to give to all of you, and that piece of information is, you see, the area above the neck, that is the face region, what happens to the cutaneous innervation of this part? It might be an interesting question, right? See, the cervical segments, they are the first spinal segments, right? So I'm telling that the first cervical spinal segments are actually involved in the cutaneous supply of the neck. And C1 does not have any cutaneous supply. It does not have any sensory cutaneous innervation. But then, who is supplying the face? Who is supplying the skin above the neck, above the area of supply of the cervical segments? The answer is cranial nerve. Spinal nerves are coming into play when the neck is starting, right? But above that, in the face region, it is a cranial nerve, or rather it is a cranial nerve, which is actually related to the sensory innervation of the face. And that cranial nerve, ladies and gentlemen, is the trigeminal nerve. Okay, the trigeminal nerve, or the fifth cranial nerve. So what did I just say here? I'm repeating it. Trigeminal nerve, or the fifth cranial nerve, is actually related to the cutaneous supply of the area above the neck. That is a face region. Okay, and let me show you how these dermatomes are actually distributed. Okay, so look over here. See, now we have a clear picture of the dermatomes of the head neck, right? See, we can clearly appreciate one thing, that C1 is nowhere to be seen. And that is on par with our discussion of C1 not having any cutaneous innervation. Remember? So see, it's not present. What is present is this. This is not V, this is 5, by the way. Roman 5. 5, so cranial nerve 5, that is the trigeminal nerve. So, see, the trigeminal nerve is actually supplying, obviously, we are talking about the cutaneous supply here, supplying the areas above the neck, that is the face region. Now, having talked of somewhat about the skin of the neck, we are now in a position to talk about the next layer. That is, yes, the superficial fascia. Okay, the superficial fascia. Although we are talking about the neck here, but you can well appreciate that this layer is quite well distributed over in the face as well. See? So what you are seeing here, these somewhat yellow colored structures, they are part of the superficial fascia. Okay, so they are a part of the superficial fascia, and they are what we call to be the loose areolar tissue. Okay, so they are the connective tissue, the loose areolar tissue, which constitute the superficial fascia. See, these are the subcutaneous tissue of the neck. Okay, see. Okay, however, let me tell you, the subcutaneous loose areolar tissue, that is not the only thing that constitutes the superficial fascia, mind you. What other constituents are there in the superficial fascia? Well, there is a very interesting muscle which is present, which is actually constituent of the superficial fascia of the neck. And this is a pretty unique muscle, and this muscle is called platysma. See? Do you see it? This is the platysma. So, the platysma is the other constituent of the superficial fascia. So, we can see that these are the loose areolar tissue, which is one constituent, and the other constituent is the platysma muscle. Okay, now this is pretty interesting. Why? Because normally in human beings, muscles are not constituents of the superficial layer. Do you get what I'm saying? Obviously there are exceptions to this, but normally we don't see that muscles are located in the superficial fascia layer. They are somewhat located deeply. However, there are some exceptions to this. The first exception is obviously the muscle that we are talking about here, that is the platysma, and we will talk about this in a few seconds. The other muscle is palmaris brevis. Remember palmaris brevis? Palmaris brevis, in the upper limb, it was a muscle, and that was also what we call to be superficial muscle. And not superficial muscle only. You see, the term superficial muscle is not fit for this, because there are many muscles which are superficial. That does not mean that they are subcutaneous as well. So what I mean to say by superficial is subcutaneous in this context. So platysma is one such muscle. And an interesting thing about platysma is that these muscles, including platysma, which are subcutaneous, that is, which are located in the superficial fascia layer of the human body. They are what evolutionary biologists say to be the remnants of paniculus carnosus. So, what is this thing, paniculus carnosus? Let me explain it to you very briefly. You see, in many animals, in many vertebrates also, um, there has been an observation of a sheet of muscle layer in the superficial region of the body. So, what I mean to say is that in many animals, including many grazing animals like cow, there is a sheet of muscle which is actually located in the superficial fascia region or layer, just like this platysma is. That is, it is subcutaneous muscle. And the function of those that layer of muscle sheet, paniculus carnosus, by the way, that layer actually serves to twitch the skin. Twitch the skin. So we cannot twitch our skin, can we? We cannot do that. On our own, we cannot. But you see, grazing animals, when there is some kind of irritation on their skin, they can twitch that part of the skin. Why? Because their entire body almost it has this superficial sheet of muscle which is subcutaneous, so it can control the skin movement, that part of the skin, which we cannot voluntarily, we cannot, right? So that is called paniculus carnosus. So in human beings, what it is believed is that we don't really have the paniculus carnosus layer as a whole. We have evolved from that. In the evolutionary tree, we lost it somewhat. But their remnants remain in some parts. And platysma, which is a subcutaneous muscle, is a remnant of the paniculus carnosus. Okay? And platysma is not the only remnant, obviously. All the muscles of this, our head region, the face region, they are all almost subcutaneous, superficial, subcutaneous. So the muscles which actually control our facial expressions, so they are actually muscles which are controlling the skin, right? Right. So they are also remnants of the paniculus carnosus. So this is a pretty interesting topic, which I hope to touch down later someday. But for now, let's focus our discussion to platysma. As you can see here, this platysma, this is only one part of one side platysma, one-sided platysma. This is the left platysma, and over here there will be the right platysma. Let me bring it up. So this is the right platysma. Okay. So let's talk about the features of this muscle. As you can see here, or well appreciate here, platysma is somewhat quadrilateral, right? It is a quadrilateral sheet of muscle, and obviously it is thin. Okay, so it is thin quadrilateral sheet of muscle, and as you can all well see here, it is starting from somewhat over here, right, and ascending upwards to the face region, right? Okay. Now, if we are to be a little bit more precise about the origin and insertion of platysma, then we would have to say that platysma takes origin from the skin and the deep cervical fascia. From the skin and the deep fascia, which is actually covering the upper parts of the pectoralis major and the anterior fibers of deltoid, like this. So let me bring those up. So now we have a more complete picture about the origin of the platysma. You can well see that this is platysma. And where is it originating from? It is not originating from any bony landmark. It is originating from the skin, okay, overlying skin and the deep fascia, which is covering this. This is the pectoral fascia. This is the deep fascia that we are talking about. So it is taking origin from this pectoral fascia, and it is also taking origin from the deltoid fascia. See? See? Let me remove this subcutaneous tissue. See, now we have a very good picture of the origin of the platysma. This is the deltoid, right? Over here. The fascia which is covering, the deep fascia covering deltoid, that is actually the deltoid fascia, right? So platysma is taking origin from the deep fascia covering the anterior fibers of the deltoid, because this is the anterior region of the deltoid, so the anterior fibers of deltoid, and it is also taking origin from the deep fascia covering the pectoralis major muscle, which is this over here. If I remove these subcutaneous tissue, you can well appreciate that this is the pectoral fascia or the deep fascia covering the pectoralis major muscle, and platysma is taking origin from there. Apart from these two sources, it is also taking origin from the overlying skin. Okay, no problem regarding this, hopefully. Okay, after origin, let's talk about the insertion. So what platysma is actually doing is it is traversing upwards and somewhat forwards. See, somewhat forwards, and it is crossing obviously this bone over here, the clavicle. So now we have a very beautiful view. We have faded the platysma muscle. So you can see that platysma is covering, or rather it is crossing superficial to the clavicle over here. You can well appreciate the clavicle. This is the clavicle. It is crossing that, and what it is doing is it is crossing the lower part of the posterior triangle and the upper part of the anterior triangle. Very interesting. Now, we obviously have not covered the anterior and posterior triangles of the neck, but okay, so you can well appreciate that here there is a triangle being formed, right, in the neck. I'm just giving you a brief introduction, brief 2 or 3 sentences as to what the triangles of the neck are. You see, you can see a triangle over here being formed. This muscle is the sternocleidomastoid. Okay, this is the deep cervical fascia. Let me hide that. Yeah. So this here is the sternocleidomastoid muscle, right? This over here, this is the trapezius muscle. Okay. So between these two muscles, and obviously here there is the clavicle. So between these structures, we have what we call to be a posterior triangle of the neck. Okay. Okay. Whereas, as you can see, this is the sternocleidomastoid muscle again, right? And this over here, this is the lower border of the mandible. This is the mandible. This is the lower border of the mandible, right? And if I draw an imaginary line from the midline of the neck region, can you visualize this? Suppose there is an imaginary line over here in the midline of the neck region, okay? And there is the sternocleidomastoid over here. Okay? And there is a lower border of the mandible. over here. So these three structures together form the anterior triangle. Okay. Now what platysma is doing is, let me bring it back. If we see closely enough, what platysma is actually doing is, it is, you can see, it is actually covering the lower part of the posterior triangle. See, this is the posterior triangle. This is the upper part of the posterior triangle. That is not covered. The lower part of the posterior triangle is covered by the platysma. Okay. Whereas here we can see that there is the anterior triangle of the neck, right? We can see that the upper part of the anterior triangle is being covered by the platysma. Can you make this out? Yes. So this is pretty interesting, and by this we also kind of, introduced the people who do not know about this, about the triangles of the neck, to the triangles. Okay. So platysma is actually going on like this, and then it is actually being inserted onto the lower border of the mandible, as you can well appreciate over here. It is actually moving on and inserted into the lower border of the mandible, right? Now what's happening is that both the platysma muscles from both sides, their fibers actually meet somewhat in and around the region of the symphysis menti. You see, both the muscle from both the sides, the muscles from both the sides, the fibers of these two muscles, although it's not clearly shown over here, the fibers of these two platysma muscles, they actually decussate with each other at about 2.5 centimeters below and behind the symphysis menti. So this is not clearly given over here. This is not clearly depicted here. But there is some decussation, that is intersection, crossing of the fibers of the opposite platysma muscles, that is the two corresponding platysma muscles, and their fibers. At what point? At about approximately 2.5 centimeters below and behind the symphysis menti. I hope you do remember the symphysis menti on the anterior surface of the mandible, right? Now, also something which is to be understood is that almost all the fibers, they are getting inserted onto the lower border of the mandible. We can well appreciate that. But there is a but to this. But there are some posterior fibers, again this is not depicted here. Some posterior fibers, what they do is, they do not directly insert onto the lower border of the mandible, but what they do is, they turn medially. Okay, they turn somewhat medially like this, and through this muscle, which is the rhizorius, can you see? Yes, this is the rhizorius. Through the rhizorius muscle, so there is somewhat some connection over here with the posterior fibers, some posterior fibers. Sometimes this is seen, okay? Most of the fibers, they are getting inserted on the lower border of mandible. There is no problem regarding that. But there are some posterior fibers which actually turn medially, and through the muscle of rhizorius, they are actually inserted onto what part? What is this? This is called the angle of the mouth. Okay, see, if this is the mouth over here, it's quite easy to visualize this. This is the mouth, right? And this over here, these are the angles of the mouth, this and this, and rhizorius actually inserts onto the angle of the mouth. So some posterior fibers of platysma through the muscle of rhizorius, they actually insert onto the angle of mouth. But where in the angle of mouth? Skin of the angle of mouth. Platysma, we learned about its origin, we learned about its insertion, and we also learned in detail about its course and what structures it actually crosses. Now, if this is a muscle, obviously, which it is, it must need some nerve supply, right? It needs some nerve supply. So, platysma, the nerve supply of platysma, what is that? Very easy. Nerve supply of platysma is facial nerve. Because facial nerve, as the name suggests, it is facial. So platysma, it is somewhat related to the face. We can see that the insertion of platysma is on the face region, right? So facial nerve, just like all the facial muscles, the facial nerve is actually supplying the platysma. However, facial nerve has 5 branches. So which specific branch is actually supplying the platysma muscle? Answer to that is the cervical branch is supplying the facial platysma. Cervical branch of the facial nerve is supplying the platysma, and let me show you that. This over here is the facial nerve, all right, highlighted in violet. Okay, now can you all see that it is giving off a number of branches? See, it's giving off a number of branches, right? So this over here, this is the highest branch of the facial nerve, and this is what we call to be the temporal branch of the facial nerve, right? See, because see how I'm telling this is because the region of the body where the nerve is located, that is the temple region of the body, right? So the nerve branch of the facial nerve related to that temple part of the body, that is the temporal branch. So this is the temple of your body, and the branch of facial nerve which is related to that part of the body is the temporal branch. Pretty obvious, right? Okay. Now, see, again there is another branch over here. What branch is this? This is the zygomatic branch. Buccal branch is the lower one. See this over here. This is the zygomatic branch, right? And that is also pretty self-explanatory, right? Because this over here, this is the zygomatic bone, right? So the nerve which is in the zygomatic region, that is the zygomatic branch of the facial nerve. The nerve which is in the buccal region over here, this is the buccal branch of the facial nerve. And then we have this over here. This is what we call to be the marginal mandibular branch. Why? Because if I remove it, if I remove the platysma, you can see that this branch, this is actually, see, running along, yes, the margin of the mandible. Margin of the mandible, this is the mandible. And this is the lower border of the mandible. So the branch of the facial nerve which is running along the lower margin of the mandible is known as the marginal mandibular branch. And even inferior to that, the branch which supplies the platysma muscle is this, the cervical branch of the facial nerve. See, this is the cervical branch of the facial nerve. Now if I bring back platysma, you cannot see the branch directly, right? But if I isolate it, or rather if I hide this or fade this, now you can see it. See this nerve, this is the nerve supply of platysma muscle. And in this process, there is a cervical branch of facial nerve. In this process, we have also kind of, at least talked about, at least now we know what the 5 branches of the facial nerve are. Just going on and telling that this is the cervical branch of the facial nerve which supplies the platysma muscle is not going to cut it, because you won't be getting that edge in your brain as to why you should remember it, and more importantly, how you should remember it. So when we will be studying about the facial nerve and the face in details, we will be talking about the branches in detail, obviously. But since we have a context to at least say, or rather utter the name of one branch of facial nerve, that is why I took the liberty of at least demonstrating to you what the 5 branches of the facial nerve are, and at least where they're located, so that there is at least some context, and you don't have to remember it right now, but it at least makes sense that cervical branch of facial nerve is the lowermost branch of the facial nerve, and that is the nerve supply of the platysma muscle. Okay, done. Now, since we are actually talking about the nerve supply, let's quickly study about the cutaneous nerves of the neck. Now, listen to me very carefully. I have already said that the spinal segments C2, C3, and C4. These are the 3 spinal segments which are actually responsible for the cutaneous supply or the cutaneous innervation of the neck region. We all know this. We know about the spinal segments, but we do not yet know about the nerves. The nerves which are being formed by these spinal segments. That is what we are going to talk about right now. Okay? So am I able to at least make you guys understand as to what the context is going to be in the next few minutes of our discussion on the cutaneous nerves of neck? We talked about the spinal segments C2, C3, C4. Those 3 spinal segments, they are the cutaneous supply of the neck. We know that. But what are the nerves? What are the name of the nerves, and what are the constituents of the nerve which is actually supplying the neck? That is what we are going to talk about right now. Now, we know that the anterolateral aspect of the neck, that is actually supplied by the ventral rami of the C2, C3, C4. The nerves which actually supply, the nerves which are actually formed by these ventral rami of these spinal segments, they are, hear me out one by one. Lesser occipital. Okay, I'm just telling you the names, okay, to give you at least a bit of an immersion. Then we'll go into a little bit details. Okay, so lesser occipital, first one. Great auricular, second one. Transverse cervical, third one. Supraclavicular, fourth one. These are the 4 names that you have to remember. These are the 4 nerves which are responsible for the cutaneous distribution of the neck. Now, before showing you the actual nerves, which I'm going to do right now, what I did was kind of prepare a mnemonic for remembering the names of these 4 nerves. And the mnemonic is a little bit, tacky. It's not very catchy as such, which a mnemonic should be, so that you can remember it. But I could not come up with any good mnemonic. However, if you can suggest me otherwise, I'd be more than happy to hear you out. So the mnemonic that I could come up with is, hear me out and don't laugh at this, Lord Gallien's tech is super cool. Okay, it's pretty, I know, weird. It might sound a little weird, I know this, but this is pretty, at least it has been working out fine for me. I can remember the names by this. Lord Gallien's tech is super cool. Lord means L-O. L-O stands for lesser occipital. Gallian, this name, actually I had a little bit of an inspiration, if you may. Uh, Talion, this name is from a character which I love from the game Middle Earth series. If any of you have played it, you know that there is the protagonist named as Talion and Celebrimbor. Anyways, it's Lord of the Rings. If you have seen Lord of the Rings, you know about the lore which I'm talking about. So there is a character named Talion. So since Talion cannot be suited here because there is no TA, I made it GA, Galleon. Okay, so GA stands for Great Auricular. So Lord, LO, stands for Lesser Occipital. Galleon, GA, stands for Great Auricular. Okay, Tech, 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 technology, Tech. Tech is TC. Okay, and that stands for transverse cervical. Okay, I could have gone with technology, the full term, but I think the other letters, they may puzzle you. Tech, if you end it there, then you have a better chance at remembering that the abbreviated form is TC. If you use the entire term technology, then you will be having a little bit more problem as to what the abbreviation was. And that would be another problem. You would remember the mnemonic, but you wouldn't remember what the mnemonic stood for. That is pretty embarrassing. It would defeat the entire purpose of forming the mnemonic in the first place. So anyways, Tech is TC and TC stands for transverse cervical. Super cool, SC. SC, super cool, supraclavicular. So Lord Galleon's Tech is super cool. Lesser occipital, LO. Galleon, GA, great auricular. Tech, TC, transverse cervical. Super cool, SC, supraclavicular. So these are the 4 cutaneous nerves which are responsible for the supply of the neck region. And obviously, the root value of these 4 nerves will be within C2 to C4. And if I am to be a little bit more precise, the root distribution is like this. Lesser occipital, this nerve, the root value of this nerve is C2, only C2. Great auricular, GA, again. So that's pretty good. And last but not the least, super cool, SC, supraclavicular. The root value of this nerve is C3, C4. So C2, C2, C3, C2, C3, C3, C4. These are the 4 root values that you, I think it's better to remember these root values. And it's pretty easy to, I think. Now let me show you the nerves quickly. See, let's start with this nerve over here. Can you see how this nerve, it's actually creeping out onto the back? And what region is this? What bone is over here underlaid by this muscle? Yes, this is the occipital bone. Obviously, this is the occipital bone. So this is the occipital region. And the nerve over here, what nerve can this be? Pertaining to our discussion? Yes, the lower or the lesser occipital. The lesser occipital. Okay, so obviously there is a greater occipital as well, and we can well appreciate it over here. See, this is the greater occipital nerve. So this is the greater occipital nerve, and obviously this is the lesser occipital. Okay, so see how the lesser occipital nerve is actually coming out. It's actually piercing this muscle over here, which is the splenius capitis. Oh, you don't have to remember that, obviously. I'm just trying to show you the nerves, okay, so that there is a little bit more immersion out there. Anyway, so this is the lesser occipital. Now, the next nerve which I talked about was a great auricular. So the auricle is over here, right? So the great auricular must be somewhat over here. See, this is the great auricular. So there is logic in the naming, right? There is certainly logic in the naming. So this is the great auricular. We found this nerve also. And you can all, if we trace these nerves back, we will see that they are actually coming out from the spinal cord. Because these are spinal nerves, obviously, right? Right. So this is the great auricular. Done. What was the next nerve? Transverse cervical. So this over here is the transverse cervical. So just below the great auricular nerve over here, we have the transverse cervical nerve. See, pretty easy. We have mapped down the three nerves. Now the last remaining nerve, which I was talking about, is the supraclavicular nerve. Supraclavicular. So it's above the clavicle, right? So let's find that out. So this over here, this is supraclavicular nerves. Okay. So let's do just one quick recap. This is the lesser occipital. Sorry about that. This is the lesser occipital nerve. This is the great auricular, right? This over here, just below it, is the transverse cervical, right? And this is the supraclavicular nerve. Okay, so that finishes the cutaneous nerve distribution of the neck region, and for now we are going to end our discussion over here. The next time we come back, we will be talking about the superficial veins, which are extremely important, the venous and the lymphatic supply of the neck, because they are pertaining to the superficial structures of the neck. Okay, so for now, adios, sayonara, goodbye. Thank you.